Dr. Benjamin Ko. He is an infectious disease expert from Asian Hospital. Doctor, thank you so much for joining us on the program. So are we on track to reach these levels by the end of July, or is this a miscalculation?
Good evening, Rico. Well, based on the data that we have, even with my prediction, more or less, we're supposed to hit about 60,000 by the end of July. That's because for just for the last week, we've managed to have at least 770 cases a day. So if you compute the 770 and we're not going to go anywhere, uh, that means that's around 20,000 cases, 21,000 cases additional on top of the 36,000 that we have already now.
So this is
So
a
that would
realistic number of 60,000 by the end of July. So why are we seeing these kinds of numbers? Right now we're at 36,000 and we are still one day before the end of June. So that will be a jump of about 24,000 by the end of July. Are we not seeing, a doctor, sufficient testing and enough contact tracing?
Well, we're doing enough contact trace. We're doing enough testing, but not that much. If you look at the numbers that we have, we've actually gone down with respect to some of the testing facilities. Like for example, today they reported 60 out of 63 testing facilities that report to the DOH. If you look at the website of the Department of Health or the health agency, you see only 49 reporting out of the 63, which means that on a day-by-day basis, you have to count the total number of testing facilities that provide the reports. Otherwise, that means that there are some areas or there are some facilities that actually do not provide these reports. Like just today, we have a little less than 13,000 tests that have been performed in about 12,000 plus individuals. And
So,
the Department of Health provides data on cumulative average. That means that this is when you talk about cumulative average, you're talking about the total number of positive tests divided by the total number of tests done over the whole time that they were doing all the tests. What I normally do is I break it down into daily averages, which means that the daily rates will matter because if you look at the daily rates, our positivity rate is much higher today than it was yesterday and higher yesterday than it was the day before. So there is a slightly increasing trend.
So, doctor, how do we beat this number of 60,000 by the end of July? I mean, will this mean then stricter lockdowns yet again for cities or at the barangay levels? Or are people not just following strict health protocols? Because I see a lot of people now on the streets, people are going to malls without any social distancing.
Well, yeah, it takes two to tango. Okay, the government can only provide so much, and with the government providing the rules and regulations, if we don't follow it as a people and we don't observe it, then nothing's going to happen at all. And we cannot enforce punitive actions on people. As a matter of fact, I think what we need to do is to change the paradigm and make the people work together with us instead of providing them um, punitive sanctions for everything that they do. I mean, it's a tough spot that we're in. Nobody wants to be in this pandemic. Nobody asked for it. Unfortunately, we are all in it, and we all have to fight it together. One suggestion, actually, which I already posted on my blog a couple of months ago, was that before any lockdown can even be lifted in a particular local government unit, that local government unit must have its own isolation and quarantine facility and its own testing facility. You see, we have a lot of testing facilities in the country. Today we broke the record, we're at 72. The problem is most of them are concentrated in areas like Metro Manila. Well, we have gazillions of testing facilities here. There are three in Cebu. Unfortunately, one of them isn't functioning. So I think that's the reason why we're getting lower numbers coming out of Cebu. If you look at the whole data of testing facility at the Vicente Soto Memorial Medical Center, They did more tests actually way back in April than they were doing tests today.
So if there are infection cases in the barangay levels, they should be moved to isolation and quarantine areas.
Yes, they should be moved to a quarantine facility so that they can get monitored. Otherwise, if they don't get monitored and they cannot get followed up, we end up with cases
Right.
wherein the transmission within the barangay area is not,
Right.
nobody watches over there. So if nobody watches over these
All
people
right.
within the barangay area, the transmission in that particularly dense population, in that dense area, is much more difficult to
Thank you so
handle.
much for joining us on The Final Word, Dr. Benjamin Ko, an infectious disease specialist. I will take this short